Those of this station, its staff, management, or sponsors. Welcome to the Ask the Experts Show with local experts in the fields of legal, health, financial, and home improvement. Enjoy being educated in such topics as personal injury law, community association law, family law, bankruptcy law, along with health show topics like pain management, men's health, and dental implants. Now, sit back and enjoy today's Ask the Experts with host Steve-O.
Hey, good afternoon, kind of evening on your 6 to 7 drive home. This is the Ask the Experts radio show. We're on every Monday and Thursday from 6 to 7 with some of the hottest, the best experts in the field of legal, health, financial, and home improvement. This is a live show. A lot of people are not doing live shows now with COVID. This is a live show, and you will love today's show. And let me introduce you to, he's been with us for a while, Dr. Eric Chardon from Broward Urology. What do I keep saying? Why do I want to say Chardon?
Think of me like if I was Chinese, and it was Chen, and then there was just the Vin.
We got to change your last name. I've had to do it. Anyway, he's one of the senior partners over at Broward Urology Center. And we're going to talk about things that are going on right now in our households. Eric, good to see you. And we were just talking about, because I really respect Eric's opinion, I asked him, I said, should kids go back to school? That's the hot topic right now. And you said yes.
That's my opinion. You have pluses and minuses, but at some point in time, we're just going to basically stunt the educational growth of our kids. And my kids are at private school at St. Thomas, but my daughter just finished 8th grade in the public system, and the learning was really, really poor. And I feel like the kids are just going to fall way behind. And not to say everyone needs to live and do exactly what we're doing, caring for patients in the office and the hospital, but I think if people are careful, if kids are wearing masks in school, and if I can wear a mask all day at work and my patient's coming in, I don't see why my kids can't wear a mask at school, and the teacher should be 6, 10, 12 feet away. Doesn't need to be on top of the children. They are protecting themselves, wearing a mask, maybe even a face shield. I think that we have workers working at Publix so we can go shopping and at a gas station and so on, and I think that the teaching is an essential service. We're doing a real disservice to our kids otherwise.
Well, you have one of the top urology centers in South Florida. Tell everybody about your practice.
So our practice is Broward Urology Center. We're part of 21st Century Oncology, our sort of corporate parent, with probably about 75+% of the urologists, at least in Broward County, and throughout South Florida and the nation. It's a huge company with a lot of urologists and other different medical specialties in there. And we practice really the full breadth of urology, from sort of general urology to cancer to kidney stones to overactive bladder, sexual dysfunction. I myself am fellowship trained in endourology or endoscopic urology and laparoscopy, and my younger partner's fellowship trained in robotic surgery and endourology. And Dr. Yogel at our helm, our senior partner, has been at it for over 30 years. Our practice has been in the community for over 60 years, I think, certainly longer than I've been around. But Dr. Power is our sort of partner emeritus, and he retired after about 37 years of practice about 8 years ago.
So, first of all, how are you enjoying the new offices?
The new office is great. As you can see a little bit in the background, I still need to do some artwork in my office. We kind of got stunted. We did a lot of artwork throughout the office. We still have the exam rooms to do, but unfortunately COVID kind of put a halt on that because, you know, no one would come into the office. No one wanted to do anything, of course. So we are going to get back on that very soon to finish off our last fine little bit of details. But we're now at our main office. We actually finished our last day at our satellite office. We're taking a break from our satellite office and really trying to focus on getting going big time with using our new large office, state of the art, and maximizing its potential. We're going to be bringing in some additional care providers and really trying to push it here and then make our way back up north probably in about a year or so.
So, have you noticed, are people still afraid to come in? I know I heard that from the hospitals. People, who needed health, had health problems, were not coming in.
Well, there's definitely been, with this resurgence, there's definitely been an issue of cancellations and reschedules. It's really been a lot, unfortunately, because we were doing really well. We really opened our doors back up for, other than just emergent patients, a few a day, where we're doing mostly telemedicine. We really opened our doors on May 1st, and it took a couple of weeks. But since then, we've been running just about at full capacity for the most part, our usual day-to-day office. And more recently, we'll have days where I think on Wednesday, I had, either this week or last week, in the full day, 10 no-shows, cancellations. So people are getting
Wow.
cold feet. I can tell you, though, I asked a 94-year-old woman that came to see me yesterday. I asked her, I said, aren't you a little scared to come into the office for risk of getting the virus? And she said, she's a young Spitfire for 94, I'm telling you. But she said, you're wearing a mask. I'm wearing a mask. You've got a face shield on. Everyone here is a mask. There's no one in the waiting area. You know, if we need to go to the doctor, we got to get out there. We got to live our lives. Let's live it safely and smartly. But that was her opinion. So everyone,
Wow.
is entitled to their own way of handling things, I guess. But to some extent, to a certain extent of whatever's going on with you medically, then you have to get out there a little bit. If it's simple follow-up, but people are kind of blowing things off a little farther than they should. And at the least of which, all of us in medicine are practicing telemedicine, telehealth. We've been doing it for 4 months at this point now and had a crash course in it. So that is still a way that we can interact and care for our patients. It's hard to do a decent exam, but a lot of times you can get 95% of what you need from a good history.
Do you see your practice changing anyway with like telemedicine, how we have to do business now? Do you see your practice changing at all?
I think, we've come to doing very little telemedicine now, 1 or 2 a day, if that, and really interacting with our patients in the office. And like I said, there's no family coming in. Patients are often waiting in their car, and we'll call them in. Everyone's wearing their PPE protection. Everyone is now in a mask. I showed you before. I'll show you my
Your
battle
shield.
gear. We've got the mask, and then on top of it, the face shield. I look like I'm going into military here, but we're all wearing this to take care of ourselves and to protect
Right.
our patients both from us and them and us from them, and so on. And really practicing our medicine in the office. And when it comes to surgery, Broward Health Medical Center, the big level 1 trauma center, has now just, as of the end of last week, now completely closed elective surgery again. Memorial Health System
Oh,
3 weeks ago. We're getting an influx from Dade County of patients that are overflow from Dade, because it's even worse down there than in Broward County.
Actually, I heard the ICU was full in Dade County, and I heard it's really getting full over at Broward. But that's why I went and had my knee surgery, because I knew this was going to happen. I knew that this virus was going to come back, and they were going to end up closing up elective surgery, my even knee replacements, elective surgery. So in a way, I'm glad I got it done, because it looks like they're going to be closing up a lot of at least the ICUs. I mean, from any elective surgery.
Correct. So I'm doing most of my surgery, and have been doing most of my surgery when able at the surgery centers anyway. Keep patients out of the hospital.
So I got to go. I hate to do this. I got to go to break. When we come back, we want to talk about the emotions, the impact of quarantine and isolation, because I'm sure you're getting a lot of feedback on that. The name of the practice is Broward Urology Center. It's the top urology center in South Florida. Give everybody your phone number.
Our phone number is 954-463-6408. And you can also find this on the web at browardurologycenter.com, as on Facebook as well. All our contact information is there, plus a lot of information on our website.
We're going to go to break. When we come back, we have more with Dr. Eric.
Are you suffering from erectile dysfunction, also known as ED? The urologist at Broward Urology Center can help men regain their sexual health in a comfortable, discreet environment. ED can result from age, low testosterone, high blood pressure, diabetes, smoking, sleep apnea, high cholesterol, and cardiovascular disease. When a man is first seen in the office at Broward Urology Center, a thorough evaluation is done by the doctor, which begins with an open, honest, and absolutely confidential discussion about their overall medical health and current sexual function. A complete physical exam is performed, and blood work is often ordered. Once a full workup is completed, a customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P-Shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954-463-6408.
You're listening to the Ask the Expert show. You can actually watch us right now by going to our Facebook, which is Ask the Experts Steve-O host, and you can watch me and Dr. Eric. We got a lot of stuff to talk about. You know, your show I could do hours of your show. There are so many different areas to go into, but today with the virus, people are going through some emotional times now with the quarantine and the isolation, with anxiety. Do you hear that from any of your patients?
I think we all hear. I hear it from my own home. I hear it in my own head. I think, we've all been going through a lot of anxiety and frustration, and for better or for worse, I've been able to get out, sometimes for worse, but been able to get out of my home and come to work. And at some points, it was just sitting in a room for 8 hours, 10 hours doing telemedicine, but at least get a change of scenery. For others, it's been sitting in the house, like my parents, older people over 60, 65 years old, my parents in the 75-year range and so on, and really trying to stay out of Dodge, stay healthy, but are really kind of locked in. There's for some it's a lack of exercise. For some, it's been an increased time for exercise. And I think people are somewhat depressed at this point, frustrated, and we hear stories about increased rates of domestic abuse, child abuse, and those things. As that frustration builds and you tend to take things out on the ones closest to you, I think that, just isolation, lack of getting out, lack of change, lack of mental stimulation, even if it's just the TV, it gets kind of tiresome, or even books that you can get online, that you start withdrawing from some of your significant others, your spouse, your friends, your family. And of course, as a urologist, I may see things like low libido, low sex drive, erectile dysfunction, sexual dysfunction. And to make matters worse, a lot of people have kind of resorted to alcohol, because if they don't have to go to work and they don't have to go out and they can't drive anywhere, there's no risk of harming themselves, but probably overdoing it quite a bit with the alcohol, which can further compound the depression and the sexual dysfunction. And that leads to a lot of relationship stress, especially with your spouse, your partner, and so on.
So performance-wise, because you actually specialize in ED, and but we wanted to talk today about how this is affecting people, because we're quarantined in somewhat of a way. So does all this mentally affect a man's performance or a woman's performance?
For sure. I think especially for a woman, which tend to be a lot more emotionally based when it comes to intimacy, and really need a little more than men, kind of need the stars aligned and whatnot. And for certain men as well, I think that that lack of intimacy, that lack of just general connection, where you may be at each other's throats, you're going back crazy, it's great to spend time with each other, but it's also healthy to have some time apart and experience things grow and come back together, and look forward to sharing the experiences you had away from each other and being able to discuss it. And at this point, if you spent the last 2,000 hours with each other, maybe more than that, there's really nothing new. And so things may feel like it's getting kind of stale. And so intimacy often falls by the wayside, or just becomes tiresome, and just further creates kind of a spiral of strife and so on between intimate partners and even friends.
I want to say this because we get new listeners every week. It used to be when a male had a problem, that they would resort to the blue pill. That was it. They went to the blue pill. Things have changed so much since those days that there's a lot of men that don't even realize all the different ways that you can do to help them. It's not just a little blue pill anymore.
Certainly not anymore, although easy to prescribe even by telemedicine. And we're back up and running from, initial new patient visits to really kind of figure these things out, to trying the oral pill medications, to further evaluation with an ultrasound in the office, and then even treatment, whether that be a needle injection, a pump, an external pump right now, not an implant, and then even the newer regenerative treatments, the P-shot, the shockwave, which we've once again gotten comfortable and begun doing in the office since we reopened in May.
But so men have options now. Yeah. And the age doesn't matter, does it?
I don't think so. I think it's not really age. It's more of an extent of the problem, the disease, perhaps how long it's been going on for. If it started for a man or a woman, if the sexual dysfunction started when you were 75 versus when you were 55, if it's been going on for 10 years, it's been going on for 10 years. If it's been going on really for 3 months, maybe with all this starting, I think the sexual dysfunction also can be, just as many of us have had a lot more time to sit around and listen to our bodies, get in our heads, listen to our mind, and really see just kind of what's bothering us. I think that there's a lot of physical ailments that probably should be addressed, and maybe people are finding out more and maybe blowing them off a little longer, afraid to go to the doctor. I've had a number of patients today come and tell me they didn't know that we were open during this whole crisis.
Right.
And most of us have made clear on our websites, on our voicemail type of things with our phone systems that we're open. But I think that when you're having sort of, whether it's minor pains, people are exercising more, maybe they're starting to have chest pain, shortness of breath. Not time to see me about that, please. But certainly time to go to your medical doctor and maybe refer to a specialist. And even if it's starting with a telemedicine evaluation, we certainly don't want things to get worse and have a problem compound. And then, of course, landing in the emergency room and admitted to the hospital, where we're trying to keep patients out of the hospital.
We just got a text in from a listener wanting to know the difference, and I think we've had this question before, the difference between a urologist and a nephrologist.
So urologist is a surgeon, surgical subspecialty. Nephrologist is a medical subspecialty. Now, we both deal with the kidneys. The nephrologists are the ones that deal with problems of the kidneys, and certainly when they're no longer functioning, dealing with dialysis and transplantation. We are the ones that deal with more of the anatomic aspects of the kidney, some medical. We share some things, like some nephrologists will also deal with kidney stone medical management, but certainly if someone's passing a stone, has a tumor in the kidney, the bladder, the prostate, the testicles, the penis, the urethra, all that kind of stuff, we're the surgeons that are going to be dealing with that, removing it, treating it, so on and so forth.
Okay. So who do they go to first? They come see you first?
Depends what the problem is. If there's an anatomic problem, they're going to come to me. If the kidneys are not working, but nothing else anatomically seems abnormal, then they're going to go to the medical side, the nephrologist.
Wow, we just got another text in. What I have listened to your show for the last 3 months. I enjoy it very much. I don't feel like my flow is like it used to be. Is that when they go to the bathroom, I guess?
I'm presuming this is a man. I'm presuming it's a man.
Yes,
we
Mark.
Deal with that a lot more. And
what should I come see?
That's definitely my neck of the woods as the urologist, dealing with whether it's in a large prostate, an issue with a scar in the urethra, the bladder not working properly. That's where we come in. And sometimes the medical doctors may have started a patient on some medication, tamsulosin, Flomax, and some others to try and help the urine stream and so on. And great if it works perfectly. If it's not working perfectly, because I've had patients come in 2 years on a medication, and when you ask, they say, it really never really helped me, but yet they continue taking it for 2 years. So that's where we as the urologist come in and do a nice thorough evaluation and see what's what, see if the medication is the wrong medication because maybe it's the wrong issue, or maybe they're too far gone for the medication to work and need some type of surgical procedural intervention to really fix the problem.
Are they doing any damage to the kidneys by continuing letting this happen?
Certainly can. If a patient is having urine retention and not completely emptying the bladder, and the bladder is really trying to contract much harder and squeeze it out through a tighter outlet, like from a large obstructing prostate, then that back pressure can feed up to the kidneys and start to damage the kidneys. And now they're going to need to go see my friend, the nephrologist. So we like to avoid that.
Well, I got to tell you, this is the fastest 30 minutes. I love doing this show with you. I could think of 50 more questions easily. Give everybody your phone number. Broward Urology Center.
It's 954-463-6408.
And you are open. You open on Saturdays or Monday through Friday?
Monday through Friday.
Okay. And give everybody your, Eric.
Say that again, Steve. I lost that.
Give everybody your website.
The website is browardurologycenter.com. You can also find us on Facebook. Same title.
So listen, thanks again. And you'll be back with us again next month, and maybe some of this virus will be gone. I love doing the show with you. This is if you ever need a urologist, Broward Urology Center, that's the place you want to go. We're going to go to break. When we come back, we're going to be talking about real estate. Thanks again, Dr. Eric.
Thanks, Steve. Stay well. Take care of those
You
needs.
too, bud. We'll be right back.
Are you suffering from erectile dysfunction, also known as ED? The urologist at Broward Urology Center can help men regain their sexual health in a comfortable, discreet environment. ED can result from age, low testosterone, high blood pressure, diabetes, smoking, sleep apnea, high cholesterol, and cardiovascular disease. When a man is first seen in the office at Broward Urology Center, a thorough evaluation is done by the doctor, which begins with an open, honest, and absolutely confidential discussion about their overall medical health and current sexual function. A complete physical exam is performed, and blood work is often ordered. Once a full workup is completed, a customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P-Shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954-463-6408. The law firm of Marlin